Hi, this is Tonya Nabelia, a CIM clinical clerk, and in this video, I'm going to show you an improvised home video presentation about endotracheal intubation. For the case scenario, given a 37-year-old male who is 80 kilograms and a BJMP prisoner who tested positive for COVID-19, had a traumatic brain injury trying to escape the hospital. He has a GCS of 8 and with unstable vital signs. He is in a critical ill condition and warrants an endotracheal intubation. Since the patient is positive for COVID-19, safety precautions should be practiced: disinfecting of the hands, wearing of PPEs, and limiting the personnel in the room. Aerosol boxes and video laryngoscopes is also recommended. Materials that will be used for the intubation are as follows. It will be remembered as the mnemonics maids: monitors, cardiac monitors and pulse oximeters, airway, IV fluids, drugs, and suction. While the materials that should be in the tray table will be remembered as the mnemonic SALT PS: suction, airway, laryngoscope, tracheal tube, plaster, and stethoscope. Assess the patient for possible difficulty in intubation. Mnemonics lemon. First, look externally for any trauma of the head and the neck. Then, the 3-3-2 rule: the distance between the upper and lower incisors, the distance between the hyoid bone and the chin, and the distance from the thyroid cartilage to the floor of the mouth. This is to evaluate the Malampati score, obstructions, and neck mobility. The ideal position for laryngoscopy is the stiffening position, which is 35 degrees of cervical flexion and atlanto-occipital extension, line of sight from the mouth to the larynx. Obese patients require elevation of the shoulder to have adequate cervical flexion. Pre-oxygenation before general anesthesia is recommended. Suction secretions present and insert an oropharyngeal airway to facilitate adequate ventilation. For mask ventilation, jaw thrust maneuver provide a tight seal. The thumb and index fingers should make a letter C shape with a downward pressure, while the other fingers form a letter E on the jaw and a fifth digit at the mandibular angle. The patient is obese, so a two-handed technique is preferred. Enter the mouth fully open with the thumb and index finger of the right hand and hold the laryngoscope using the left hand. Introduce the blade at the right corner of the mouth, sweeping the tongue towards the left. Keep the wrist fixed. Hold the glottis upward in a way to visualize the vocal cords. Insert the endotracheal tube with stylet at the right corner of the mouth and let the tip pass through the glottis opening. Inflate the balloon with 10 cc of air. Then, remove the stylet and attach the tube to a bag valve or breathing circuit. While bagging, auscultate to evaluate the placement of the tube. If the right lung was noted to be louder, the endotracheal tube might be lodged at the right bronchus. Deflate the balloon completely and pull the tube 1 cm at a time. Inflate the balloon again and auscultate for equal breath sounds. Once it's done, secure the tube with plaster and insert an oropharyngeal airway to avoid biting and easy suctioning of the secretions. Thank you for watching, and just a friendly reminder to wash your hands frequently.